This mixed methods systematic review, written by myself and co-authors, focuses on both the effectiveness and family experiences of interventions that promote partnership between families and health professionals in pediatric and neonatal intensive care units. The intensive care environment can be very overwhelming for families. They have a very sick child, and the procedures and equipment and environment is usually unfamiliar, and there's a lot of knowledge to absorb, and of course they have a lot of concern for their child. To help families in this environment, paediatric and neonatal intensive care units have implemented partnership interventions to improve family psychosocial outcomes. In our research, we've searched for and synthesised the existing research studies on these interventions and their effects on things like anxiety, depression, stress, and satisfaction with family-centred care. We wanted to understand both the measurable effect of interventions as well as families' experiences of them. And in our searches, we found 6 qualitative studies and 42 quantitative studies on this topic, and we've combined their results in this systematic review. Our meta-analyses found that benefits of these partnership interventions were seen for anxiety, stress, as well as satisfaction with family-centred care. We couldn't find conclusive effects on parental attachment or depression. Experiences of families involved in these interventions showed that they experienced significant impacts from having their child in intensive care, and also that partnership can improve their capacity to care for their child. Most of the studies that we found included only parents of the child, but future research should also include other involved family members. This might be grandparents or siblings. One of the challenges with combining these studies was that there are many interventions undertaken, and not all the studies were the same intervention. Because of this, we recommend further studies include multiple partnership activities. Activities might be things such as family education or participation and increased physical contact with their child. Through partnerships with families and health professionals in paediatric and neonatal intensive care units, there can be better outcomes for families and promote their well-being as they care for their sick child.